Okay, what we're going to talk about this time is therapy, and that means therapy to treat major disorders. And so we'll spend some time talking about the major kinds of psychological therapy and also about physical therapy. So psychotherapy is psychologically based therapy, and it's often used to treat less than major disorders or as an adjunct or add-on to biological therapy. Biological therapy is used to treat major mental disorders like schizophrenia. The first psychological therapy is psychoanalysis, and Freud is the one who kind of piloted this, and his belief was if you could bring those unconscious wishes, which was one of Freud's favorite areas, into consciousness, it would help them solve their problems. And so the techniques that were used were free association and dream analysis. Free association is kind of the stereotypic Freudian therapy where the patient lies on a couch or just gets comfortable and just talks uninterrupted by the therapist. The idea is that the person who's speaking will become more and more comfortable and gradually reveal more about themselves, not only to the therapist, but to themselves. Dream analysis, as we spoke about in the dream chapter, states of consciousness were also discussed in that chapter, is actually used by Freudians to try to understand the underlying symbolism of dreams. So psychodynamic theory then, in summary, the idea is to enhance self-insight with this Freudian therapy and to focus on themes across important relationships. And it tends to be individualized, face-to-face, and can be lengthy compared to some other therapies. The second major type of psychological therapies are the humanistic, and this is going to mirror what you would expect from humanists based on your knowledge of this school of philosophy. The therapy is called client-centered, and it's called that because there's the idea that the client should always be first and foremost in therapy and treated with respect. This was postulated by Carl Rogers. It's non-directive, which means that the humanist does not tell the person what they quote-unquote should or shouldn't do. Instead, they listen to you carefully, they listen to discussion, they reflect what you say, and the hope is that you'll actually discover as part of this process what you should do. That's always much more powerful than a therapist or any other person telling you what to do. Active listening is a technique associated with humanism, and it really just involves reflecting what the person is saying, but also, more importantly, reflecting the emotion that you hear or the thoughts that you hear underneath what they're saying. Unconditional positive regard, as you might expect, is also a part of humanistic therapy since it's an important part of humanism. And in this context, unconditional positive regard refers to the respect that a therapist should show a patient. And to get an example of this, there's a really famous classic clip of the humanistic therapist Carl Rogers treating a young woman named Gloria. And so if you go to YouTube and type in Carl Rogers and Gloria counseling, it'll take you to that clip. Behavior therapies tend to be much more focused, and they tend to work very well with phobias. Exposure therapy is a general class of techniques that's used to treat phobias. Systematic desensitization is one particular form of this, and it is effective in getting rid of fears. In systematic desensitization, you gradually pair more and more threatening or more feared associations with the phobic object to the patient. So for instance, at the start, you may have the patient make a list if they're afraid of spiders, of what they could stand at the moment. It might just be looking at a picture. And then you have them keep going until they get to their worst fear, which might be being in a room with a spider. So in systematic desensitization, you start very gently with the first behavior, just looking at a picture of a spider, and then you pair that with relaxation. And you keep that up until the person's no longer fearful, and then you go to the next step. Now, a much more controversial form of exposure therapy is much more direct and short term, and it gets around the problem that we have with some forms of therapy for people who suffer from phobias, and that's that they tend to drop out. They don't want to come every week and deal with it. So this kind of intensive exposure therapy just takes a few hours, but most definitely you would never do it without an expert to guide the process. And if you want to see an example, you can go to Snake Phobia Behavioral Exposure Therapy on YouTube. Aversive conditioning is another technique that's within behaviorism, where you tie a negative experience with the behavior you want to decrease. And this just associates that behavior that you want to decrease with something unpleasant. So, for instance, if you put a rubber band around your wrist and snapped yourself every time you reach for a cigarette, that's aversive therapy. Probably for good, clear reasons that you can understand. This is not the first line of help with behavior therapies. Another example of a behavior therapy is the token economy, and there's just a process here that shows you how it might be used with children. You start out with a child without any access or tokens, and tokens are usually just like, let's say, plastic coins or smiley faces, and they don't have any access to desirable items or activities. Next, you tell them what activities they need to engage in order to earn a token. Next, you give them a token immediately after they engage in those behaviors. And last, the child trades the tokens for access to the desirable items or activities. That tends to work very, very well, especially with children, although it's been used successfully in other contexts. Cognitive therapy, specifically cognitive behavioral therapy, combines the strengths of behavioral treatment with the strengths of cognitive therapy, which tries to change or shift irrational beliefs. So, for instance, in the diagram, let's say that somebody comes in to a therapist and they say that they're really anxious when they're criticized at work. And the cognitive therapist has them explain what they feel when that happens. Like, for instance, they might think they're not good enough, or they're stupid, or they're going to get fired. And then they identify the emotions. How does it make you feel? Worried, anxious? And then you move to the behavior. What does the person do when they feel that way? Do they tend to isolate themselves? Because it'll actually make the situation worse. And then they'll focus on the body's physical reactions. If they feel tired, they may lose their appetite, they may feel a little sick to their stomach. And so the idea in cognitive behavioral therapy is to actively challenge irrational beliefs and to help the person adopt more rational and more self-supported behaviors and belief systems. Group or family therapy just really tells you about the unit of analysis. It doesn't tell you anything about the philosophy of the therapist. For instance, you wouldn't know if a family therapist was a behaviorist, cognitive. You just couldn't tell from that. But you would know from this title that they think the group or family unit is important. So, for instance, in group therapy, if you had individuals who shared a social phobia, they may be in a group together, and you treat them as a group so they can provide social support. In family therapy, the family is treated as a system. So, for instance, if the father was alcoholic, you'd not just treat the father, but you'd also treat other family members who have to learn how to deal with the alcoholism and how to kind of take care of themselves, as well as the individual who's dealing with alcoholism. And then self-help groups are just, of course, where people may read books or go online and get other group members who share similar experiences to provide support. Let's talk about biomedical therapies now. So we're really changing gears here. And this is drug therapy. And we're going to talk about 3 different types of drug therapy for 3 different disorders. The first category is antipsychotic drugs, also called anti-schizophrenic drugs or neuroleptics. Antidepressants are a second class of drug, and we'll tease these antidepressants into a finer distinction of different types of antidepressants. And finally, mood stabilizers that may treat manic depressive disorder. So to begin with, anti-schizophrenic or antipsychotics are used to treat schizophrenia, and they're used to treat process and reactive subtypes. of schizophrenia. And if you recall, process schizophrenia is the type that develops slowly and reactive develops faster. The drugs include things like chlorpromazine, thorazine, clozaril, and the effect is to block, not completely, but partially block or reduce sensitivity to dopamine. And so if you remember, schizophrenia is linked to too much dopamine, so anti-schizophrenic drugs reduce that. Some of the side effects include things like tardive dyskinesia, which are tremors mostly noticeable in the hands. There's actually a classic kind of movement by people who have been long-term on anti-schizophrenic drugs called pill rolling, where the thumb works against the hand. Dry mouth and kind of general flattening of emotions are common complaints among those with anti-schizophrenic drugs. Antidepressants include Elavil, Marplan, Aproniazid, Prozac, and Zoloft, and the effect are mood elevators, and we'll dig into the biochemistry of that in just a minute. The side effects may be drowsiness or faintness since they influence neurotransmitters such as serotonin associated with sleep. But you can, of course, go to the physician or psychiatrist and they'll try to maximize benefits of the drug and minimize the side effects by changing sometimes both the type of antidepressant and the level. So let's look at the types in more detail. Antidepressants elevate serotonin and or norepinephrine. The first class of antidepressants are called MAO inhibitors. And MAO stands for monoamine oxidase. You don't have to know that for the exam, but just for your own information, MAO actually breaks down serotonin and norepinephrine. And so inhibiting MAO will raise both serotonin and norepinephrine. The second class are called tricyclic antidepressants, and these also raise both serotonin and norepinephrine, but they do so by a different mechanism. They keep these neurotransmitters in the synapse longer, and by keeping them in the synapse longer, or that gap between neurons, it allows serotonin and norepinephrine to work longer. And finally, SSRIs, or selective serotonin reuptake inhibitors. As you would guess from the name, serotonin alone is targeted in these kind of antidepressants, and reuptake inhibitors mean, again, that you're keeping the neurotransmitter out in the synapse longer. And finally, there are mood stabilizers, and these mood stabilizers are used mainly for bipolar disorder to try to regulate those cycles of mania and depression. And much like antidepressants, these mood stabilizers tend to work for many people. Lithium carbonate is the class of drugs used to treat mood stabilizers. And as a side effect, you have to monitor the level of that in the blood. When someone is on a mood stabilizer, the psychiatrist often tells them that they need to come in to have their blood checked, and the reason for that is that it can be toxic at high levels. And that concludes the therapy chapter, and I hope I contributed to your understanding of psychological and biological therapies.